Hello. My name is Amanda. The following presentation is based on a mock psychological assessment. The dialogue between myself and the patient, Mrs. S., is fictional and for educational and training purposes only. Good afternoon, Mrs. S. Thank you for taking the time to meet with me today. My name is Amanda, and I have the results of your recent evaluation, which we will review together. Can we tape your feedback session for my record? Yes, that would be fine. Thank you for allowing me to record our session. First, I have a copy of the results for your records. We also will email a copy of the results to your physician, Dr. RN, whom you indicated were allowed to receive copies for their records. You can also update whom we share your results with at any time if needed. I want you to know that this review process is to ensure you understand what we found and how the results can help you move forward. Please feel free to stop me at any point with questions or concerns or to adjust the pace of the review. Before leaving today, we want to be sure you understand everything, answer any questions, and are comfortable with any recommendations for follow-up based on the evaluation. Does that seem like a good plan? That sounds great. Excellent. So, you were initially referred to your care physician, Dr. RN, after experiencing a traumatic event while enlisted in the Army. Is that correct? Yes, that sounds about right. You were then referred to us by Dr. RN because there was a concern that despite some improvement in your mood after psychopharmaceutical treatment, you are continuing to experience anxiety and difficulty concentrating, which has impacted your work and school functioning. Is that also correct? That also sounds correct, yes. Last week, we performed a complete evaluation of those concerns, which included a review of your medical, family, and social history. We observed and noted how you acted and reacted both during the interview and testing processes. During the testing processes, you completed a few different tests, which measured various factors. For instance, you took a test to measure your intelligence, also known as a cognitive assessment. You also took tests to see how well you made decisions and retained information, as well as personality and mood assessments to gauge your general character and behavior. Overall, your test scores reveal that your mental functioning is within an average range. There is no indication that you have severe deficits in your abilities to understand, process, and remember information. However, the tests indicated limitations in your ability to execute math effectively and some minor reading and comprehension difficulties. Although, when you were given extra time during testing, your scores improved. It was also observed that your stress levels remained elevated before, during, and after testing, which leads us to believe that your anxiety directly impacts your functioning, including your ability to concentrate under pressure. We feel that you would benefit from a few accommodations tailored to address how your anxiety and limitations in mathematical computation affect your ability to function at work and in school. I will also review some suggestions for your continuation of care to help you improve your daily functioning. Do you have any questions so far? No, nothing comes to mind just yet. Okay, we can ask you, employer and teachers, to allow you to use a calculator to do math problems. Also, when you are given work and testing that require mathematical computation, you should be afforded extra time to complete tests, frequent breaks during the processes, and an atmosphere free from distractions. Do you think that those adjustments will bolster your professional and academic ability? Yes. I always have trouble finishing time tests, especially math tests. Extra time will be helpful, but how does taking breaks help? Taking breaks can help you maintain attention and focus on finishing your goal by providing stimulation rather than sitting continuously, which can cause fatigue and anxiety. We also recommend that you begin talk therapy promptly and continue it regularly to address your anxiety, improve your self-outlook, and help find solutions to managing your time and organizing activities that work best for you. You can begin to incorporate simple solutions, such as taking manual notes in class and keeping a written log of your day-to-day appointments and activities. Also, take breaks when doing projects at home, and try to do only one project at a time. Lastly, incorporate routines, such as putting your purse and backpack in the same spot every time you arrive home. It will take some work and dedication on your part, but your symptoms are manageable, and as the tests indicate, you can improve with some adjustments. If you have no other questions or concerns, thank you again for taking time out of your day today. Also, do not hesitate to contact me through your patient portal, or you can schedule a follow-up session if you have questions or concerns later. I will refer you to my colleague, Dr. Y, to start talk therapy and encourage you to schedule an appointment with the receptionist on your way out.